Morning, young ladies and gentlemen. Today is an exciting day. Model UN. You're representing a country or a group or some kind of a constituency in which you will address an important topic, meaning vaccines or affordable medicines for, to some extent, the current pandemic that is affecting all countries in the world. So, with regard to the pandemic, once affordable medicines and vaccines are there, among the big questions is who would get the vaccines and who would get the affordable medicines first, and how and why and when. So this question is not easy because there's not enough medicines and vaccines immediately to satisfy all countries and all populations. One may learn in this respect from some earlier examples, like HIV/AIDS, which was a pandemic several years ago, and Ebola 7 years ago in West Africa, where international collaboration under the leadership of the UN prevented the Ebola epidemic in West Africa from becoming a pandemic. That collaboration does not necessarily mean that everything always goes smooth. Even diplomats and countries among themselves often have hard arguments, including the multilateral UN organizations. I remember that in meetings with WHO, UNICEF, the World Bank, the Gates Foundation, everybody who was involved, CDC for the Ebola, we had many hard arguments. Who should do what? You should do this, and when you do this, you don't do it well, and why does my population not benefit and only yours? Those kind of intrinsic, very difficult arguments. So now we have the pandemic. For the pandemic, we have a few drugs already, but insufficient, that can be used in hospitals, and we also have vaccines. And actually, this month is a very exciting month, because last week was for the first time that a new vaccine developed by a German company, BioNTech, jointly with Pfizer here in the United States, showed that that new vaccine was very effective. So that prompts immediately a very relevant, and therefore today relevant for your discussions, who would get this vaccine and when and why and where. So if this new vaccine is being produced in the United States or Germany or Indonesia, would then Germany or Indonesia or the US people get it first? Or would the people who need it most get it first? In Brazil or in Kenya or in India perhaps? All those discussions that you're having among yourselves should analyze that and should rationally try to come to a decision who would have the best chances and rights to have access to that vaccine. And of course, in those discussions, concepts like inequality, inequity, poverty come along. Some countries are very poor that you represent. Some other countries are very highly developed and seem to have an advantage with regard to medicines and vaccines. And how does one balance this in a way that is fair to all people in the world? To some extent, you can argue this is a matter of power and money, if one is very direct. But only politics along lines of power and money would be very ugly. Ultimately, one needs to collaborate all together, and especially with a pandemic, since it would be in everybody's interest to work together. That includes industry, but it needs UN leadership. The United Nations is the best organization to provide that global leadership to collaborate together and provide solutions for something like a pandemic that we are facing now. So I wish you a wonderful day today for your discussions, your diplomatic debate, and try to have this debate along lines of reason, argue with arguments why Brazil should get the vaccine or the medicines first over and above Mexico or Nigeria, or the other way around, and what would be your arguments. At the same time, do not argue only along emotions. Emotions are good. Sometimes they reflect passion, and passion means involvement in the subject, so it can be done, but it needs to be done all together. So finally, remember, this is a pandemic, so it affects all of us, and therefore the solutions for the whole pandemic in terms of interventions with vaccines and affordable medicines need to be underwritten with all of us. This is a pandemic that can only be solved if we do it all together in the context of the United Nations. I wish you a wonderful day and good luck with your diplomatic debates today. Bye-bye.